most doctors will tell you neuropathy is forever, but Dr. Maggie isn't most doctors.
Well, you know, conventional medicine and conventional docs are going to tell you that neuropathy is forever. And if that's the case, honestly, I'd be dead. So me and the people I work with say bye, Felicia, to neuropathy. So we're going to go ahead and dig right in. Jacqueline, let's bring you on. I want to hear your story.
I'm Jacqueline Reed. I'm a wife to my wonderful husband, Chris Reed. I'm a mother of 3 sons, 2 of which are twins, and I'm a grandmother to 7 beautiful children.
What?
Wow.
Say what? I
Yeah.
did not know that.
And I also am a retired landscape designer.
Oh, I might need your services.
I'll travel 3,000 miles to do it for you. How about
Oh
that?
my God, love you, love you. Wow. Okay. So, Jacqueline, what diagnosis were you dealing with prior to the program?
I have psoriatic arthritis, psoriasis, and mixed connective tissue disease.
Actually, psoriasis and psoriatic arthritis is associated. One of the diagnoses associated with neuropathy. That is a commonly associated with one, but the mixed connective tissue is not. But I can tell you right now, Jacqueline, my experience and your experience, MCTD has a shit ton to do with neuropathy because do you know why? There is connective tissue in nerves.
Yep.
Ooh. So all of you have MCTD, UCTD, whatever TD, scleroderma, any sort of in that family of connective tissue, there's connective tissue in nerves. So can they be a target of autoimmune attack? Can we get neuropathy? Yes, yes, and hell yeah. And interestingly, let's talk about mixed connective tissue since you and I are both twinsies on that. When you have mixed connective tissue disorder, any sort of trauma, we can have a lot of herniated disc in neck or back. I mean, I herniated my disc in my low back at 21. And then after a minor car accident, I had 2 slip discs in my neck that never healed, requiring 2 fusions and went through hell and I never healed. I didn't know I was mixed connective tissue at the time. I didn't know the neuropathy associated was autoimmune related. How was your mixed connective tissue and joint issues?
I had a lot of spinal issues. I mean, severe spinal issues. I had degenerative disc disease, and I had a surgery to have my disc replaced. I also had to end up having fusion and a bone graft because I was in such bad shape. And it did nothing but make the whole process worse.
Yeah.
My neck, it started to begin to make the nerves in my neck hurt, in my face. And I thought it was TMJ, but I wasn't clenching my teeth, so I didn't know it was making my teeth hurt too.
Right?
But my hands and feet were excruciating to the point I would go to pick something up and I couldn't really feel my hands and I would drop things. I couldn't open things. I was having trouble walking. I mean, to the point I'd shuffle my feet. I also had plantar fasciitis.
Oh my God, plantar fasciitis. I had it for 3 years, lady.
And it's horrible. Mix that with your nerve pain. My feet was like a crumpled up mess, like walking.
I would never wear heels or even like anything again.
Just walking was like literally walking on glass.
It was.
It's terrible.
But Jacqueline, people don't think plantar fasciitis is related with autoimmune, and I can tell you right now, yes, it was. And especially, I was not just one foot; I had both feet.
Me too.
See, the both feet tells you that there's something systemic in your body going on. One feet less likely autoimmune, but if you have it both feet, there's something in the system that's attacking these connective tissue, right?
Yeah.
Jacqueline, did your doctor have any connection for you that this could be autoimmune?
No, just really didn't. When I talked about it, they just really just kind of glazed over or whatever. Especially being in both feet, they were like, that's uncommon, or
It's really common if you have autoimmune disease, baby.
Right, exactly. To add to it, the ligaments in my heels felt like somebody were trying to pull the ligaments right off my body on my heel. So the heel was pulling and the foot, I couldn't walk. It was horrible to do that. And it's so wonderful not to have that. I don't have that at all. I'm not woke up at night with all that. And let me tell you, when I came into this program, you say your 3 must-haves.
I tell people to list what are your 3 must-haves. I do.
Right.
They're non-negotiable. You must have them.
This didn't even enter into my mind because I've been told by every doctor that there was no cure for this. that just get used to it, and it's probably going to get worse. And to the extent I even had a spinal cord stimulator implanted to try to deal with some of the pain. And I ran on high dose all the time, and it did not take away my pain. And my pain, nerve pain, started to increase more and more. And I'm going to tell you, this week I have not had my pain stimulator on at all.
Jacqueline, what I'm hearing from you is you were in truly excruciating pain, as you said. I'm thinking, would you say level 10 at times?
Oh yeah, yeah, 8 to 10 every day.
And now you're saying it's often gone? Like, you're at what level would you say now?
Really, in the past week, it has gone down to where I virtually have no nerve pain. I turned off my stimulator. That hasn't happened since I got it 4 years ago.
And she turned off her nerve stimulator.
Turned it off.
You know it's real.
Had you done the program first, you wouldn't have even had it implanted, probably.
Probably, but I was desperate. I had been through every kind of medication, patches. I did epidural injections.
Me too. Surgery, 2 neck surgeries.
Well, I've had 4 back surgeries.
And it didn't help.
And it didn't help. In fact, it made things worse. It really turned on my autoimmune disease to another level.
It did for me as well, Jacqueline. So tell me, like, on a scale of 0 to 10, 10 being the most neuropathic pain you have, 0 being nothing, what's your average level right now?
Basically a 0 to a 2, maybe. I mean, I'm really not in the past week, and it's just been a week. Like, my fingers, I couldn't even move my fingers like this. I couldn't even move this first digit and bend it.
So you're saying
picking up things was
now
hard.
you can flip me off now?
Well, I could, but I would never.
Well, okay. I want the audience actually truly understand that these kinds of results are unheard of in the conventional world. But we see this. I mean, we see this every day in the program. These are typical results. Okay. But Jacqueline, what was your biggest linchpin? What's your secret sauce? What did it for you?
Well, this is going to sound weird to everybody out there that doesn't know anything about your program.
Yeah.
And it hit me like from left field. Blood sugar balancing.
Yes, yes, and hell yes.
Yeah, you told me you probably had this all your life.
I didn't say probably. I said you had this all your life.
Yeah, and I look back and I had so many hypoglycemic events in my life.
Low blood sugar.
Yeah, and I've never been a good sleeper.
Low blood
my mom said even when I was a baby. Okay, so take that back to the beginning. I think the major thing balancing my blood sugar has done for me is it has brought the inflammation in my body way down, which is the cause of most pain is inflammation.
Well, I mean, Jacqueline, here's why this case study is gold. I want the audience to really understand why this case study is gold. I teach the 5 pillars, right? In my 5 pillars training and our transform protocol, I really isolate what are the 5 pillars that really feed autoimmunity, right? To me, actually, the single most impactful, quickest return on getting the fastest result is blood sugar, actually. People think it's just all about high blood sugar. And the truth is, Jackie's case just told you that it's the high to low to high. It's the swing that's actually triggering the autoimmune attack. So she can remember from when she was a child, she was having hypoglycemic episode, low blood sugar. So people think that the answer to blood sugar balance is just, I'm going to cut sugar and call it good. No, Sherlock, if that was the case, none of them need to be in this program. I mean, tell me some things practical that you really learned, that you really did, that helped you master stabilizing your blood sugar throughout the day. So there were no highs and there were no lows.
Well, first of all, we start with the fiber, protein, and fat ratios of our plates. We're pretty equal. Yeah. And to not go past 3-4 hours eating, and to bookend our day, we start with our day with the protein and we end our day with the protein.
Yep. How many of you guys noticed that late afternoon or in the middle of the night was when you have the most pain? Yeah. Ding, ding, ding. Winner, winner, chicken dinner. Write it down and comment. I want to hear from you. That's low blood sugar. So how many of you have migraines out there? Guess what? One of the biggest triggers of migraines is low blood sugar. Wow. right? So blood sugar is huge. I actually have a training around how blood sugar impacts upon autoimmunity. If you're interested in watching, I did a blood sugar workshop. Type in chat blood sugar workshop and we could share that resource with you. And all of you that are commenting, make sure to check your Facebook message requests because we're sending you resources through Facebook Messenger. If you're on YouTube later in the day or tomorrow, check your replies. We do reply and we will get the resource to you. Okay. I'd love to share some of these resources.